Hello, everyone. My name is Jeff James. I'm the CEO of Wilmington Health. This is the third installment of a conversation between Dr. Paul Kamitsuka and myself. Dr. Kamitsuka is one of the infectious disease experts here at Wilmington Health, and we greatly appreciate his time and his willingness to provide some insight into all that is currently going on with COVID in our community. Dr. Kamitsuka, welcome.
Thank you.
So here we are again, a few weeks later, and the situation is changing. Can you give us a brief update on what you're seeing in the community?
Well, unfortunately, we're seeing a steady rise in the number of cases of COVID-19. Currently, there are almost 10 times as many people hospitalized with COVID-19 as compared with, say, Memorial Day. This is a direct result of the failure of people to socially distance. With all the gatherings during Memorial Day weekend, we've seen a surge of cases since then. We have yet to see a surge of cases from July 4th weekend, but so long as people are not masking and so long as people are congregating, we're going to continue to see a problem with increased cases.
So let me ask you something that's on everybody's mind right now. What do you see happening with the school reopenings and the plan for the schools?
Yeah. So this is a difficult question to answer. I think all of us want kids to be able to go back to school. We know that education happens in a better way when kids are physically present in school, but I think all of us also want to make sure that it is done in a safe manner. The governor just released his plan for schools in North Carolina, which I think actually is a reasonable plan, and it is it's contingent upon really where we are with regard to this pandemic in North Carolina. If it remains out of control, then it would be slanted toward mostly remote learning. Whereas if we're able to get better control, then there will be a mixture of in-person and remote learning with masking and distancing incorporated in the school with avoidance of crowding, such as in the cafeteria. If things are way down, then it would be much more looking like normal. I think it depends upon the citizens of North Carolina. If we really want our kids to go back to school and have an experience that somehow resembles normal, then it's going to be incumbent upon us to make sure that we do all of the social distancing, the masking, etc. It's been estimated that if everybody does that, then we would have 80% fewer cases by the time school starts. And it's really the issue here is really within our hands. It's so easy if everybody just does masking. And the government, the governor has a plan, including the kinds of safeguards that would be necessary to make it safe for the kids.
Okay, so what's the latest on vaccines from your perspective? I've seen a lot of things in the news lately that they're making some progress, but I don't know how much progress or how long it's going to take.
So no one knows the answer to that question, unfortunately. There is a great deal of activity in terms of trying to get a safe and effective vaccine internationally. There are probably about 120 vaccine candidates that are at various levels of development across the world, at least a dozen here in the United States. I think we can be hopeful, but this, if a vaccine is demonstrated to be safe and effective within the next year, this would be unprecedented speed in terms of getting to that point. I know the NIH has sort of geared it to be as quick as it possibly can be. But right at this point, I think it would be fair to say that things are promising for the future. I would not expect it within the next year. If we're extraordinarily lucky, extraordinarily fortunate, everything will fall into place to make that happen. And then the next hurdle is if there is a vaccine, will people take it? And current polling suggests that maybe a third of people, even if there was a safe and effective vaccine, wouldn't take the vaccine. So there are a lot of moving parts, but there's a lot of work being done to try to get this to happen. We don't want to rush into it without making sure it's safe. Last time that was done, for example, in 1976 with the swine flu vaccine, there was an excess number of cases of neurologic side effects. And the vaccine manufacturers are well aware it's got to be both effective and safe. We need to stay tuned and remain hopeful. But in the meantime, we have to deal with the tools that we have available to us.
And how do you see the upcoming, fall season? When would we expect to see flu in addition to COVID?
So, yeah, I mean, the one thing about flu season, it's as certain as death and taxes. Flu season will come, but it comes on its own schedule. Sometimes we'll start flu season here as early as October, more typically December, January. So no one knows the answer to that question. The only thing that we can say with certainty is that it will come, and that we need to be prepared for it. The most important thing people can do to try to mitigate the effects of the flu is to get the flu shot. And the ideal time to get the flu shot would be in September, latest in October, just so that you have immunity already built up before flu actually strikes. And we do unfortunately anticipate that we will have a double whammy. The flu will be here and COVID at the same time. A lot of overlapping symptoms with the two infections, but different ways in which we have to deal with them. Fortunately, we do have medication for flu, which works if it's given early in particular. There's emerging therapies for COVID also. The one agent that shows promise, unfortunately, is still given intravenously, but more and more we're coming to believe that if it's given early, it could have a major impact in terms of how bad the disease is. We're looking forward to the development of orally available anti-COVID medications similar to the medications that are available for influenza.
That's interesting. Do you think that to the extent that we are improving our social distancing and wearing masks, that the same things that may slow down the COVID cases would also slow down the flu cases?
Yes, I think that is the expectation. If we socially distance and wear masks, that should lower flu too. I was just having a conversation with a local restaurateur, and what he's found over the past 5 months is that he's seen less of his employees calling out sick during the past 5 months than previous years. And it maybe is, in fact, related to social distancing and masking. We would expect if people mask, social distance, and do hand hygiene during flu season, that should mitigate that as well.
Yeah, that's great. And so one last thing. In our last video, it was mentioned that it may take 2 or 3 years until we return to normal again. Other than the things that you've mentioned, is there anything that you could share that would help us shorten that time? I mean, is it still down to social distancing, wearing the mask, washing your hands, all of those things that we continue to repeat?
Right. So short of there being an effective and safe and widely used vaccine, that is the case. But you know, the positive thing is that the data suggesting that, for example, simply wearing a mask will go a long way toward hastening that return. The data has become really much more strong. If all we have to do is to look at what other countries have done. Let's take the country of Taiwan as an example. Taiwan has a population twice that of North Carolina. They are located very close to mainland China, and early in this pandemic, there was a lot of back and forth traffic between mainland China, which was the epicenter of this virus, and Taiwan. As soon as Taiwan got wind of it and started seeing cases in Taiwan, everybody masked. 100% of people masked. And in addition, they were very aggressive about testing, isolating cases that they saw. How many deaths from COVID have there been in Taiwan? 7. So far, we have almost 1,600 in North Carolina. And moreover, they never shut anything down. None of the businesses shut down in Taiwan. So everything was kept open. All they did was to mask everybody, aggressively test, contact trace, and isolate. We can do that too. So if everybody masked now, 100% of people did not congregate, we could quickly lower the number of cases, say by 80%. And once you get down to manageable levels, then the testing and contact tracing and isolation can take care of the rest. So it really is within our hands to be able to tackle this pandemic. We just have the will, we just need the will as a population to make it happen. Other countries have done it. Taiwan has done it, South Korea, the countries in the European Union. Austria, for example, they made it mandatory with fines for people to wear masks, and they were able to mitigate this pandemic. So we can do it. There's no reason why we can't, but it's as simple as wearing this every time you go out of the house. That's
right.
It. Just this, yeah. So,
yep, absolutely.
Yeah.
Dr. Kamitsuka, thank you so much. Really
Sure.
appreciate your time as always, and appreciate your dedication to our staff and the community and our patients. So thank you very much. If you're looking for more information on COVID-19 from our experts, please visit Wilmington Health's website at www.wilmingtonhealth.com. Also, for up-to-date information on local COVID cases and statistics, please visit ncdhhs.gov. Thanks, Paul.
Okay, thank you. All right, bye-bye now. Bye.